Hello everyone, my name is Natalia and I am a massage therapist at Maddie Studio. My main specialization is facial massages, various types of facial massages. And today I want to talk about transbuccal massage or intraoral massage or buccal massage. It is called by different names. Its essence is the same. It can be performed for both therapeutic and aesthetic purposes. For therapeutic purposes, it is especially relevant to use it for people who have problems with their bite, problems with chewing, tension in the masticatory muscles, the chewing muscle group, who have diagnosed bruxism, or in general have tension in the jaw, neck, and temple areas. Its main feature is that it is performed from inside the oral cavity. We take a glove and work through the muscles from the inside. In other words, we cover a larger area, we have a deeper impact, a greater impact, a stronger one, and this helps to overcome the problem of tension in this area more quickly, making my work more effective. How does this massage differ from, for example, Kobido massage? Transbuccal massage is performed first of all from the inside, and secondly based on indication. That is, there is no point in doing it for relaxation. This is not a relaxation massage. It is a specific technique that combats a problem which arises either at the client's request or emerges during the process of diagnosis, visual assessment, interviewing the person, or during the massage itself. If there is a need for such a technique, I clarify with the person whether they are ready for it, because not everyone will immediately allow you to get into their mouth for various reasons, including the fact that there might be some contraindications to this massage. This applies to recent injection procedures, recent visits to the dentist, gum diseases, oral cavity diseases, inflammatory processes, and so on. We discuss all of this during the session and decide whether we will do it today and continue with it in the future, or if we are not ready to go inside the person's mouth yet and will work from the outside, which also yields results, but is often slower and sometimes more painful. What it has in common with Kobido is that it also has several stages, but they differ from the standard one. Also, what they have in common is that we work on the neck area, partially the back area, the scalp, the ears, and so on. In other words, it is not just done from inside the oral cavity, but the entire upper part of the body is also worked on. If necessary, we later refer the client for a back massage or any other massage or technique that the person needs for their specific request. Now we will briefly demonstrate the technique, how our practical part takes place. What is this? No, I'm afraid. I didn't see it. This will be backstage. Wait, is that all? A characteristic difference of transbuccal massage is working from the inside of the cheek. We put on gloves. We ask the person to open their mouth. And we carefully enter inside and ask them to relax their mouth. And we begin to perform the characteristic movements for each muscle group to work through the problem. Are you alive? Uh-huh. According to the specific requests from the patient, the clinical diagnosis, and the existing physical problems we have identified, we carefully work with those specific muscle groups to ensure we address the root cause of the discomfort effectively. I just wanted to double check with you real quick. Are you able to see everything that is currently being shown on the screen right now? Or is there anything that seems to be missing or perhaps cut off from your view? I'm all done. Are you alive? And how is it? Oh, it's like it feels really great. Well, I had to do this cheek for you. For whom actually is this massage suitable? Collaborating with an orthodontist, we concluded that often people who have been prescribed a night guard for bruxism to prevent tooth wear, or who have been prescribed orthodontic treatment in the sense of braces, retainers, or aligners, very often these people need a transbuccal massage to relieve muscle tension and assist in the work of the orthodontist themselves. The same applies to people who have problems with the jaw joint. But for all these signs, you should first ask your own doctor, orthodontist, or nathologist whether it is allowed to perform this massage, because in some cases, any massage, whether external or internal, is contraindicated. Therefore, if you have any doubts, please first consult with your orthodontist or gnathologist, depending on who you are receiving treatment from. But if this massage is permitted for you, then we can work on relaxing the muscles so they don't put such pressure on the neck, teeth, and don't affect your posture in that way. They very often cause pain in the shoulders, neck, and so on. And in the moment, we can improve your well being, make your life easier, and relieve some of this pain. Also, if you have a diagnosed case of bruxism or show signs of bruxism, I highly recommend transbuccal massage as well. What does it consist of? Bruxism is the clenching of teeth. This manifests especially at night, but in very severe advanced stages, it can manifest during the day. That is, people might work out while clenching their teeth, do something with intense focus, or sit on work calls and clench their teeth constantly. And only when they pay attention to themselves do they realize that they are in pain, that their jaw is clenched. This can be caused by a malocclusion, dental problems, and most often it is stress. Problems with the jaw joint and stress has a very big impact on this. Right now, we are all stressed. When the body cannot find another outlet for this tension, it starts clenching its teeth. Tooth wear begins and the dental arch starts to become misaligned. This leads to it deepening even further. In advanced cases, people simply cannot open their mouths even to eat a sandwich, or it causes them very severe discomfort. Headaches are also a frequent result. They can be caused by bruxism, tension, chest tension of the chewing muscle group. And how do we work with this? If it is diagnosed bruxism, then an orthodontist or dentist prescribes their treatment in the form of splints, in the form of braces, and so on. That's he takes care of the teeth. From a psychological point of view, we try in various ways with specialists to get out of this state where we are grinding our teeth so much. And from a massage therapist's point of view, I do it so that your muscle relaxes, so there isn't this tension. Mechanically, I do it through mechanical influence, and so that these problems don't get any deeper. So these are the three approaches we can use to fight this problem. If you don't have a diagnosed case of bruxism, but you suspect you have it, then first and foremost, you should consult with a doctor. And depending on what they recommend, we can then start working on your chewing muscles with a transbuccal massage. This is the fastest and most effective way to combat this problem, because from my own experience, I understand that for many people I have worked with, transbuccal massage helped them faster and more effectively. Problems with chewing muscles are not always that obvious. Very often people don't even know that pain in their body can be related to their jaw. What does a foot have to do with a jaw, or a shoulder with a jaw? One of the most interesting cases I've had was when someone was referred to me for a transbuccal massage. Although from the beginning they came to the manual therapist with a complaint that their shoulder was hurting and they couldn't lift their arm into the correct position. This was causing discomfort, restricted movement, and pain. During the diagnosis, it turned out that the cause wasn't even in the neck, but specifically in the chewing muscle. And after a few sessions, changes began in the chewing muscle, meaning it relaxed, and it stopped pulling on the neck and stopped pulling on the shoulder. Yes, the work on the shoulder continued, the work on the chewing muscle continued, but significant relief was felt precisely after the work on the chewing muscles began. One of the most interesting cases was indeed when a person came in and said that they couldn't open their mouth more than a centimeter. Indeed, I mean, very often people try to help themselves with their neck by any means possible, but here the person simply couldn't. Their chewing muscles were so clenched that they just couldn't open their mouth any wider. It wasn't transbuccal massage right away. We just couldn't, because physically I wouldn't be able to insert my hand, or, well, it would be very painful for the person. We don't work through pain. I don't work through pain. At first, it was external techniques, working with the neck, working with the back. Gradually, we reached the point where we could physically just get into the mouth and start relaxing that muscle. It became easier. The work continues. After 2 sessions, the result was already felt that the mouth started to open at least enough to get some food in there and chew it properly. Sometimes people come in and say, look, I feel such tension in my chewing muscles that it gives me the impression that it's causing a headache. It feels like I'm chewing it into myself. It happens very often that our chewing muscle works in our body in conjunction with our temporal muscle, which is located on our head and works together with the neck muscle. When it overworks or underworks, depending on the condition, and all the muscles start to get involved to help it, the muscles of the neck, including the front ones, then the person accordingly, their head gets compressed. This person's head gets compressed, their neck gets compressed, their head starts to tilt back because they can't chew otherwise, except by they a person can only open their mouth by trying to lift the upper jaw, not by lowering the lower one, but by lifting the upper one, and accordingly with the entire skull. And this causes headaches, discomfort, and restrictions in the movement of the neck. Working on the chewing muscles together with all the muscles that are associated with them simply helps to restore the natural physiological pattern of chewing and help this person. I have a lot of people who have jobs related to speaking, to facial expressions, and for them, buccal massage very often helps, because the best way to work through the entire lower third of the face is precisely from the inside. We work with both the chewing muscles and the cheek muscles, the muscles of the mouth, the muscles of the lips, and this together gives them relief. On one hand, it becomes easier for them to speak. They are not constantly clenched. They don't have this restriction. And this also affects appearance, because the absence of tension in the face, particularly in the lower third, indicates that there is no lymph stagnation. Wrinkles do not appear or appear more slowly. It reacts differently. The face becomes fresher. So there is an additional bonus here. We are working on our health, and additionally, it affects our appearance. Very often, it's related to the fact that our masseter muscle, the chewing muscle group, compresses, it blocks the flow. The drainage of lymph from the face through the parotid lymph nodes and then down the neck, because this is compressed by an overstrained muscle, and people simply swell up. Because even though everything is fine with them, they have no problems with hormones or anything else. It's just that their muscles are so tight that they don't let the lymph pass through. We work on the muscle, perform lymphatic drainage massage, and achieve good results. How often should the massage be done? It depends individually, because we don't work more often than once a week, and with good progress, we extend the interval between massages to once every 2 weeks, 3 weeks, or a month. And then we can quickly track it, meaning the person comes in for preventative care. We notice that they got stressed somewhere, a muscle tensed up. We quickly relieve that almost instantly, and the person goes on living their life. There are cases where we work every week, every 2 weeks, simply because the pattern remains the behavioral pattern of clenching the jaw, and people need more frequent intervention, specifically manual massage, specifically transbuccal technique. Regarding collaboration with an orthodontist, very often people are referred to me who already have braces installed, with the orthodontist's permission for transbuccal massage. Because when our teeth are being realigned, each tooth has its own ligament. It starts to move, it starts to shift the entire dental arch along with it, and this affects the chewing muscles, subsequently the neck, and further on to the shoulders. People who have dealt with wearing braces very often complain that they started having headaches, their back started hurting, or the nature of their back pain changed. And this process can last from half a year to several years. The main work is done by braces, of course, but to alleviate the condition, to knead this muscle a little, these muscle groups, and to help a person go through wearing these braces more easily for their health, for their well-being, for work, and in principle for life. Transbuccal massage is also very suitable. I really like that I can support a person during that period when they are finding this period difficult. That's all. I invite you offline to Krakow, to the Maddie studio for transbuccal massage and other types of massage. Subscribe, like, and see you in the next videos.